If you can't define a problem, you can't fix it. That is the starting point behind a new federal push on ultra-processed foods and food ingredient safety. For years, Americans have heard the warning, eat less ultra-processed food. But federal agencies have not had one clear, consistent definition of what that means. Now, HHS, FDA, and USDA are moving toward the first proposed federal definition of ultra-processed foods, so researchers, schools, hospitals, policymakers, and families can work from the same playbook. The goal is simple: make the food system easier to understand and harder to hide behind. Ultra-processed foods are being discussed because research has linked high consumption to serious health concerns, including obesity, type 2 diabetes, heart disease, inflammation, and other chronic conditions. Processing is not the only thing that matters in nutrition, but industrial processing may be its own important factor, beyond sugar, salt, fat, or calories. That definition could shape future research, food labeling, school meals, hospital meals, military food programs, and the choices families make in grocery aisles. But the second reform may be just as important: closing the GRAS loophole. GRAS stands for Generally Recognized as Safe. When Congress created the Food Additive Law in 1958, that exemption was meant for familiar ingredients with a long history of use, things like salt, vinegar, flour, and spices. Over time, that exception became a major pathway for new ingredients to enter the food supply. In many cases, companies could decide for themselves that a substance was generally recognized as safe without notifying the FDA first. That means the agency could lack a complete picture of what is actually being added to human and animal food. The proposed change would move the system from voluntary notification to mandatory notification for new GRAS substances or new uses. In plain English, if a company wants to introduce a new ingredient under GRAS, it would need to tell the FDA and explain the science, unless an exemption applies. For ingredients already on the market, the proposal includes a streamlined pathway and a public-facing inventory, aimed at greater transparency. This is not just about regulation. It is about trust. Parents should not have to become full-time ingredient detectives. Consumers should not have to wonder whether the FDA even knows what is in the food supply. And responsible companies should compete by making food that is safer, clearer, and more real. Speakers framed this as a bipartisan moment. Researchers, parents, health advocates, and policymakers from different backgrounds pushing toward the same basic principle. Americans deserve honest labels, strong oversight, and food policies focused on prevention, not just treating disease after it appears. So the call to action is clear: demand transparency, read labels, support stronger food safety oversight, push companies to reformulate,